30 seconds.
Minister, I note the publication of the winter plan. Late, I suppose, but better late than never. Other states and jurisdictions do publish theirs in September. It's unfortunate that we wait until it's actually winter. However, the plan is of no use and will be of no benefit unless there is commitment from the staff involved to actually engage with all of the changes and make sure that it's rolled out. So my question is a very simple one about the status of negotiations between the Minister and his office and the HSE and the people who will be actually delivering it on the ground.
Minister, 2 minutes.
Thanks very much to Deputy O'Reilly, and I think I may have interpreted the question wrong. I think there's two aspects to it. One is the winter plan, but also how we're engaging with the staff, I presume in relation to the rollout of the winter plan, as opposed to more broadly. So ensuring that services are planned to meet critical periods of demand is of course a core operational function of the Health Service Executive. My department has engaged extensively with the HSE throughout the year to ensure the most effective response to the challenges faced by the Health Service this winter. As part of this process, we've had integrated winter preparedness plans being developed by hospital groups and community health organisations to meet the anticipated surge in demand for healthcare services during the winter. The plans are designed to optimise existing resources and also to encompass operational management of patient flow and maintaining public health. The recent patient experience survey found that 81% of people surveyed said they were always treated with respect and dignity in the emergency department, and ensuring that the values of patient dignity and respect are upheld at all times will remain a key priority. The overall winter plan, which runs until the 31st of March 2019, was endorsed by last week's Emergency Department Task Force meeting, which, as you know, is co-chaired by the INMO. The plan includes a 4-week period of focused action from the 17th of December to the 13th of January. During this period, 9 key hospital sites of concern will be targeted with a suite of enhanced actions, including extended opening hours for local injury units, minor injury units and key primary care centres, winter-ready clinics in the community targeting at-risk groups, increased diagnostic access for GPs and extending hours of service in hospitals so people don't find themselves delayed or stuck in a hospital whilst waiting for a diagnostic test, and enhanced senior decision-making across the hospitals. A central component of the plan, which is already underway, is the provision of an additional 550 home care packages over the winter period to help patients return home from hospital with the supports they need. The winter plan will also seek to increase bed capacity in Q1 of next year. Over the past 12 months, we've added an additional 240 beds, and work is nearing completion on a further 78 beds due to open in the next few weeks. In addition to winter funding, 10 million is being made available in 2019 to increase acute bed capacity, and further details will be included in the National Service Plan. And very importantly, Lascian Corla, taken together, these initiatives will increase the number of available inpatient beds in the acute hospital system to over 11,000, a threshold last seen in 2009, showing that the lost decade perhaps is now over. The HSE advised that a briefing for the staff panel on the overall winter plan will take place this week, and any clarifications required will be provided in the forum, but the INMO have very much been co-chairing Emergency Department Task Force meetings. And my understanding is the plan will be published tomorrow by the HSE.
Deputy O'Reilly, 1 minute.
I was a member of the Emergency Task Force. It's not an industrial relations forum, and they were always very clear with us about that. So participation or otherwise does not indicate agreement by any trade union or representative group with regard to what's planned. So you're talking about enhanced actions and clinics and etc. Now, it actually, I suppose, should be said, we don't just have a crisis in winter, thanks to this government. We now have an all-year crisis. But let's just deal with winter for the moment. I asked a specific question with regard to whether or not there had been negotiations, because what you're citing here are significant changes in work practices. So you're talking about people moving out to winter-ready clinics, enhanced actions. I did ask the HSE some very pointed questions about this, and they weren't able to point to any level of engagement. Now, I know that there is, it's not sufficient to say that 2 weeks after the plan has been published that there's going to be a briefing. I'm asking about the status of negotiations. Can you say now, Minister, that the representative groups for all of the people that are going to be involved in the plan are fully signed up to it, number one, and number two, that you actually have the staff to deliver it?
Yeah, so at the Emergency Department Task Force last week, we heard from HSE management, as would the INMO have heard at the meeting that they co-chair, they would have heard that there was significant buy-in for this plan from health service staff, including their own members, right across the country. And I think there is that, and I think it is important to point that out. I mean, a lot of what we're asking people to do here is a core part of the responsibilities, making sure that actually we can deal with increased demand. I don't think it involves protracted negotiations with the unions. I certainly don't think planning for the winter period should involve that. But there will be a briefing for the staff panel by the HSE on the overall winter plan taking place this week. Clarifications required will be provided, and I want to, on the record of this House, thank the staff who have been involved in formulating these plans in individual hospitals, in individual CHOs, and are very much signed up and bought in and invested in relation to these plans. People in our health service work extraordinarily hard. I'm very proud of the work that they do, and it's important that staffing levels across the hospital, in our emergency departments and diagnostics, in the community, in primary care services are sufficient. That's part of proper rostering, which management are obviously paid to do, and I've no doubt that that's happening at individual sites right across the country. There is, as you say, the ED Task Force is not an industrial relations forum. I'm glad to hear you make that point. I very much agree with that point, but there will be a briefing for the staff panel this week, but I don't envisage a difficulty in this regard. What I do envisage is a lot of healthcare staff working extraordinarily hard over the winter period, as they do all year round, and I'm very grateful to them for their work in that regard.
Signed up, bought in and invested. That is certainly not what individual healthcare workers are saying. So with regard to the plan, and my question was specifically about the status of negotiations. So what you're saying is you don't think that negotiations are going to be required, that there will be no changes in work practices. So if there's no changes in work practices and everything will be as it was, well then the 500 odd people on trolleys, we can expect that plus whatever for the winter surge. I mean, is that what you're saying, Minister? Because if there is going to be a change in work practice, that should be negotiated. If there's not going to be a change in work practice, well then that's the same work practice as before and nothing changes and everything gets worse steadily in the way that it has continued to. My question was about negotiations. It's not about whether or not there is some good feeling towards having a plan, late and all as it was. There probably is good feeling towards having a plan. But my question is, have the changes in work practices that you have outlined when you alluded to the new clinics and the potential changes in rosters, have they actually been agreed with the staff? And I make the point about the emergency task force, because it isn't an industrial relations forum, because we were told repeatedly that it's not an industrial relations forum, but every time that the representatives of nurses and other healthcare workers tried to raise industrial relations issues at it, we were told there is an industrial relations forum. That's not a briefing, that's engagement. Engagement is what fuels industrial relations, and I'm just curious if there have been any negotiations, what is the status of those, and if not, well then I can only expect that there won't be any change in work practices. My
understanding from the Irish Nurses and Midwives Organisation, not to speak for them, but my recollection of the request at the Emergency Department Task Force last week, which I do point out they co-chair, it's an important point to make, was that there would be a meeting of the staff panel. And that is happening. That is happening this week, and it's happening as a result of their request. But we were also told at the Emergency Department Task Force that staff right across the country had volunteered to alternative rostering, had put their names forward and put their hand up to play their part this winter in dealing what is a significantly busy time. And I accept that there's challenges all year round, but a particularly busy time in relation to this. We are delivering a winter plan this year that will see in 2019, for the first time since 2009, more than 11,000 hospital beds operating right across the health service. We are seeing a situation whereby we are trying to take a different approach this year in terms of looking at all of the winter, but also looking particularly at the period from the 17th of December in through to the middle of January, where we know there tends to be a particular surge. I'm looking at also appointing, the HSE appointing a clinical lead, like we did for the papal visit, so that they can be coordinated. So there's a lot of work going on here. I don't believe there's a particular animosity or disagreement here between the health service and the unions. And certainly I'm not aware of any.
Final supplementary.
The National Joint Council, I'm assuming this is where the staff panel are meeting. That is an industrial relations forum. I will. That is an industrial relations forum. You tell us that staff have volunteered for change of roster and change in work practices and that they have added their names to lists. Could you please advise to who is coordinating those lists? Is it being done centrally? Is it being done on a site-by-site basis? And when you were advised of all these volunteers, was that by the HSE or by their representatives?
Minister, short.
So this matter came up at the Emergency Department Task Force, co-chaired by the HSE and the INMO, which I attended last week in Dr. Stephen's Hospital. These issues were raised, and the response from the HSE was that at an individual site level, rostering was being addressed. They were satisfied that rostering was being addressed, but as was appropriate, it was seen beneficial to brief the staff panel this week, which is exactly what's going to happen. So I really don't think there's an issue here. I want to thank the staff for developing their own plans, not centrally handed down plans, but individual sites, individual hospitals, individual community health organisations have developed their own plans. I think that's right and proper. It gives locally people an ownership of the plans, and I'm very pleased that we're in a position as a government to resource.
Margaret Murphy O'Mahony's 30 seconds to introduce.